Well, ladies and gentlemen, a very warm welcome to 5 Minutes with eCancer. I'm Richard Sullivan, the Chairman of Trustees for eCancer and also a Professor here at King's College London. I'm absolutely delighted to be with us today, Professor Tezer Kutluk, a great friend and colleague. We've worked together for many, many years. Not only is he a world-famous childhood cancer specialist, he's also been one of the leading lights in developing cancer systems in Turkey, and particularly for his institution, Hacettepe University, which I'm sure he'll tell us a little bit more about in a moment, and has been one of the leading lights of the Research for Health in Conflict program, which has been running over the last 4 years. And Tezer's joined us today to talk about a couple of papers that he and his colleagues published in eCancer. The first one here about progress in palliative care for cancer in Turkey, and also more recently, the effect of COVID-19 pandemic on paediatric cancer care, again in Turkey. He's done some exceptional work in these two areas. Tezer, maybe before we could talk in the detail of the papers, maybe just give our listeners a sense of the work you've been doing over the last decade with your colleagues in Turkey leading up to this particular work.
For many years, I have witnessed the progress in the palliative care, but me and my colleagues wondered where we are at the moment. So we discussed what shall we do. We decided to conduct a systematic literature review. We read more than 300 articles, plus we made interviews with the significant key opinion leaders. That part is not published yet, but we published our literature review in eCancer. Basically, what we find and what we saw from this literature review findings, palliative care, there were not that much thing on the palliative care before 2000. Just very few initiatives mainly focused on the pain control. Then starting with 2000, when the care of the oncology made progress in Turkey, palliative initiatives started growing. But we don't see that much until 2005. We have a patient directive is published. Then actually Ministry of Health started a program, Paediatric. They suddenly understood there is a growing need of the palliative care in Turkey. They came with a program, Paediatric, but it ended up with a directive brought by the government in 2015. In one of the figures in our publication, one might see that there is almost no bed, palliative care specific beds in Turkey, but now I would say in 2021, there are more than 5,000 beds specifically for palliative care patients in Turkey. This is a very good progress. Plus, the human workforce. Now, many anesthesiologists and some oncologists have an interest on the palliative care, but still what is needed is the missing part of it is the integration with the oncology care, with the palliative care, still is an area for investment.
Yes, I mean, maybe let's dive a little bit into the papers, and I'd be interested in your reflections on Turkey's progress within universal health coverage, and you know, as a country in the region, you've done huge progress around universal health coverage for cancer. But as you say, you know, there's been challenges of bringing palliative care in. What do you think has changed the attitudes towards palliative care and oncology over the last decade?
The awareness is still not at that level we desired from the public side, but from the professional side, awareness has increased significantly in the oncology community and the other professional community. But still the missing part of it is still people think palliative care is the end of the life care. So palliative care still is not starting from the diagnosis of the cancer patients. This is why I am telling you in my previous sentences, there is a need for integration, better integration of palliative care services with the oncology care in Turkey. Yeah.
And you've been working obviously very closely with Professor Richard Harding at the Cicely Saunders Institute on programs of work over the last 4 years. And I wonder if you could just tell us a little bit about your insights specifically into childhood cancers and palliative care, because this is obviously one of the most socially sensitive areas in terms of oncological care. What have you been doing and what have you found?
Most of the palliative care are provided within the pediatric oncology wards led by the pediatric oncologist. Although some of my pediatric oncologist colleagues have an interest on the palliative care, still there are not that much specific pediatric palliative care departments in Turkey. Although Ministry of Health, within those 5,000 beds, there are some new pediatric palliative care centers are open, but still we need a progress. In collaboration with our colleague Richard Harding from UK, King's College London, we are working with that team, Jordan and King's College and Hacettepe, and the Children's Outcome Scale for Palliative Care. This is an ongoing study from our side. But in summary, we are taking care of our children in need of palliative care in the pediatric oncology ward, but still we need extra human resource, human capacity for pediatric palliative care in Turkey also.
Right, and I just want to pick up on that because I think the paper you published in eCancer on the effect of COVID-19 pandemic on pediatric cancer care was extremely important, and you said in it, and I quote here, the findings suggest significant damage to pediatric cancer care during the pandemic, something I think we've seen around the world. And I guess my reflection to you there is, as countries exit the pandemic, apart from the workforce issues and rebuilding the workforce issues in pediatric cancer care, what do you think you need to do as a country and regionally to actually put pediatric cancer care back up to the highest levels again? What do you think your main conclusions would be at this stage?
I mean, in the article we published, the damage created by the pandemic in the pediatric cancer care, number of the outpatients, number of the inpatients, diagnostic procedures and the treatments were decreased in the tertiary care level in major cities. I mean, coming to a different era in the COVID pandemic, now still the number are high in Turkey, but we never stopped treating pediatric cancer patients, but they did not apply to those third level pediatric cancer centers. So after the pandemic, we might see an increase in mortality. I don't expect that much increase in the mortality, but maybe 5 to 10%. We have a nationwide pediatric cancer registry. We can try to measure the survival rates in post-pandemic period, but we still don't know how it will be affected. But it is, let me give you another example, how we are affected by the pandemic. This is different than the pediatric cancer. The screening, Turkey has a national screening program led by the Ministry of Health. In 2019, before the pandemic, 7 million people were screened by the national screening program. In 2020, the first year of pandemic, the number went down to 3.5 million. Getting adopted in the second year of the pandemic, 2021, it increased only to 4.5 million. So not yet at that level of the pre-pandemic level. This is how we affect it. So my reflection, it will affect the pediatric cancer care results in any way, although I don't have any solid result yet, Richard.
No. Well, that's absolutely wonderful. Tezer, again, thank you so much indeed for your time today to give 5 minutes with eCancer. And again, ladies and gentlemen, thoroughly recommend you go to the eCancer website and read both these papers. They're fantastic insights into the work that Tezer has done with his colleagues, and gives you a sense of what progressive universalism is looking like for cancer care, and some of the challenges that have been thrown up by the COVID-19 pandemic. Professor Tezer Kutluk, thank you so much indeed for your time today. It's been wonderful listening to you. Thank you.
Thank you also, Richard. Thank you.